Morning. How's everyone?
Well, thank you.
Excellent. You're all ready to go? Great. We're coming to you today from the Brisbane Convention and Exhibition Centre, one of our many vaccination hubs that are open this weekend. So if you're in and about town and you haven't got your booster yet, you haven't got your second dose yet, or you've got a child, 5 to 11 say, who's going back to school tomorrow and hasn't had their first dose yet, bring them in here to the Convention Centre. No appointments necessary, they can just walk in and get vaccinated. In the last 24-hour period, we've recorded 5,746 new cases of COVID-19. That includes 2,131 self-administered rapid antigen tests reported through to Queensland Health. That means there's currently 48,447 active cases. We did 14,490 tests in that 24-hour period. Tragically, 9 more Queenslanders lost their lives in the last 24-hour period, bringing our total number of deaths in this pandemic to 277. 268 of those are since the 13th of December. Of the 9 deaths in the last 24-hour period, 7 of those were in residential aged care that we know of, bringing the total number in residential aged care to 141, more than half of the total number of deaths experienced so far. 663 patients are inpatient in public hospitals, 45 in intensive care. In addition, the private sector is taking care of 63 patients, 2 of those in intensive care, meaning there's a total of 726 Queenslanders in hospital with COVID-19. We continue to edge ever closer to our 90% second dose vaccination target for people 16 and over. We're now at 89.92%. I think that means that if we can vaccinate the same number of people as we did yesterday, we might finally get there. Children 5 to 11, now 38.77% of those have had their first dose, as I say, before returning to school, and we've now received 2,135,000 of the tens of millions of rapid antigen tests that we've ordered. The Chief Health Officer is up next.
Thank you very much, Deputy Premier. So sadly, we have 9 deaths to report today. That brings the total number of deaths reported in Queensland to 277, or 268 since the 13th of December when the borders were open, specifically associated with the Omicron wave. In terms of the deaths today, there was 1 person in their 50s who was unvaccinated, 1 person in their 60s who'd received only a single dose of vaccine, 1 in their 70s who'd only received only a single dose of vaccine. In total of those 9, as we had 2 unvaccinated, 2 who had had a single dose of vaccine, 4 who had received 2 doses of vaccine, and none who had received the booster. There was also 1 for whom we have no data. So the pattern is becoming increasingly clear. Most of the deaths we are seeing in Queensland are in the unboosted older age group. So unboosted older Queenslanders are at highest risk of death. Also, there is a significant risk of serious illness and death in the unvaccinated younger age group as well. But as we're now 90% double or close to 90% double vax, we focus more and more on those boosters in that older age group. The good news is in the hospitals we have had a further substantial reduction in the number of inpatients in public hospitals, down to 663 from 727 yesterday. So 663 in the last reporting period, down from 727. That includes 45 in intensive care, down from 46. In the private hospitals, the numbers have been the same, 63 in the private hospitals. I might leave it at that and hand back to the Deputy Premier. Thank you.
Questions?
Are still ready for the return, given that children are only 38.7% vaccinated?
Well, they are. We have a very detailed return to school plan that has been implemented across schools. The last element of that plan was making sure we had sufficient rapid antigen tests so that parents could get their children tested if they had symptoms. We now have those tests. They're on their way out to schools and they'll have them available during the week.
Should we expect that there'll be another wave in the next couple of weeks to talk about this?
Look, as we've always said, the delay in the start to school has delayed the transmission of that transmission that may occur. So we should expect to see cases, continue to expect to see cases, but dragging that out has been a good thing. You've seen how that's relieved the pressure on the hospital system, allowed our hardworking doctors and nurses and health professionals, AMBOs as well, to take care of people. I might get the Chief Health Officer to speak to that.
Well, we certainly are expecting cases and outbreaks in schools. That's inevitable. The impact, there will be some children. Some children will get sick enough to be admitted to hospital. We sometimes do see some respiratory illness that requires hospitalisation. Bronchiolitis is one of the complications that can occur. And there is some very rare complications, this multi-system inflammatory disease, which is very rare. And no doubt some child in Queensland will get that, but it's rare. So hospitalisations associated with the children themselves, I would not expect to be in very large numbers. There will be some, but not large numbers. The bigger risk in terms of hospitalisations is more the child bringing the virus home to the parents and grandparents, particularly if the grandparents aren't boosted. So yes, we do expect to see more cases at the schools open. The impact on hospitals is unclear. I'm not expecting a substantial impact on hospitals, but we're prepared for it.
Do you expect it will sort of move asymptomatically through?
Oh, absolutely. We know that young people and children in particular can get very mild, unrecognised illness. It happens.
Is there data on the vaccination rate for young children in particular areas of children not getting vaccinated, which school parents may get?
I'm not aware. I don't know that. I'm sorry.
Are you expecting schools to shut down? What's the threshold before you would shut down?
Very unlikely to be shutting down schools. That's certainly a very much a last resort. This is not like 2021. There are not major plans to shut down schools. We want to be able to control this virus at classroom level. If kids are sick, they should need to go home and quarantine. But our goal is not the same. Our goal is not to completely contain this virus. Our goal is to minimise hospitalisations, to minimise illness. So it's not impossible, but it's unlikely.
So there's no real threshold that, say, 50% of a school community has?
Not specifically. The public health units will look at individual schools as cases do occur.
Evacuating aged care facilities is a very big and difficult task. I know from firsthand how challenging it can be and how disruptive it can be for those residents. These are not, by and large, very mobile and well folk, and so if you think about moving people who have mobility issues, many of whom have dementia and confusion issues, moving them from their home can be very dangerous for them, and so that's why it's a last resort to do so. I understand there was that one facility at Bethania yesterday that the Commonwealth was working with. Of course, in an emergency situation, the state and our AMBOs and our health services know what to do and can do it, but it should not come to that. These facilities, the staff and the residents should all be double vaccinated and boosted. Now they're not. We know they're not because it's coming through in the death figures. We can't get data, though, to tell us how many residents have been boosted, which aged care facilities are all boosted, which are below targets, where the Commonwealth has been and where they haven't been. And so it's very difficult to see where we can assist. We've requested that data. It hasn't been provided to us. And as you've seen over recent days in particular, if more people were boosted, then less people would be dying. But it's not just the deaths that's impacting on residents, it's the cumulative impact of staff shortages, of isolation requirements, of other supply chain issues. We've got people now who have been isolating, who are feeling very isolated. The impact on their mental health is significant. They're not getting the regularity of care that they're used to, whether that's bathing or other assistance. They're not getting, in some cases, the medication and medical care that they would normally receive because their facility has staff off with COVID or because they've been potentially exposed to COVID. So right now, that's the epicentre of what's going on. Right now, that's where it's happening, and that's rightly should be the focus.
Are there any other particular centres that Cheddar Gardens, Seven residential care? Is there another centre or are there others?
Not that I can specifically name, but we know there are more than 1,000 facilities nationwide experiencing an outbreak. That's a lot of facilities, a lot of residents. We obviously hear some reports, we hear from concerned family members, but it's very difficult from a state perspective to get that kind of transparency into these places to see, for example, how many of them are operating on skeleton staff, how many of them have had to cut back the amount of care provided to residents.
How many do you think there are seriously understaffed?
Well, the aged care workforce in some ways is not dissimilar to other workforces, and so I think just about every part of the economy has experienced these kind of workforce shortages in recent weeks, and so we would expect that many aged care facilities are experiencing these shortages. Some are better equipped to cope with it than others, but it's difficult from a state perspective to get that level of transparency, unfortunately. I do hope that the Commonwealth is able to identify where these issues are quickly and step in to assist.
Were government staff told not to leave the digital footprint in the lead up to the 2017 election?
Not that I'm aware of.
Deputy Premier, will the government commit to release the state archives report into the regulatory manner that was handed to the PSA and RTI in October 2017?
My understanding is that report went to the CCC and it informed their findings.
There haven't been any recommendations released or made public from that. Mark Summer's called for that to be released.
Look, I understand that it informed the CCC's findings. Obviously, anything recommended by the CCC will be implemented. I know there are other recommendations that are in the process of being implemented by that department.
Is there any reason though why it couldn't be released just because it went to the CCC?
Well, I understand that it was provided to the CCC as part of their investigation. Their report has been released and is public. Oh, I don't agree with those claims. Many of the matters that were outlined there have been addressed in an unfair dismissal hearing, but I certainly don't agree with those claims.
Do you have a communicated with anyone or using private?
Not that I'm aware of, no.
He says there's a culture of not even allowing RTI requests in certain instances.
I've not experienced that.
So you could technically publish that report. There'd be no reason why now you could come out and just release it.
Well, that would be a question for that department and the CCC.
But you could, like, given to clear the air, you could release it if you wanted.
Well, it's not up to me to release it, but that agency could consider it and the CCC could.
Cabinet could decide though to clear the air.
Look, I'm not aware of the exact status of that report or its contents. There's often a variety of reasons why things can and can't be released, whether that's because they're informing ongoing investigations, there's legal advice that might contain private information or cabinet in confidence information. So there's a wide range of reasons why reports do or don't get released, and I'm not privy to all of those considerations. You'd have to put those questions to that department.
The court I'm referring to is handed directly to DG, not to CCC.
Well, my understanding was that the DG provided it to the CCC, but I'm happy to check that for you.
Are any of these lawyers claims valid?
Look, a number of the matters that have been raised were considered in that unfair dismissal hearing. I'm not aware of some of the instances that are referred to there, so I'll leave his statements to him.
What do you think was his motivation for going public? Do you think is this a case of a disgruntled employee wanting to kick the government on the way out?
Look, as I've said over the last week or so, in terms of people's motives, I'll let them answer those questions.
At what point did you stop using Gmail back in the day?
Look, this was all publicly reported at the time. There was a couple of instances where I think in one case I'd forwarded a speech to my home address to print it at home. In another case I'd sent an email with test in the subject line to test that my email was working. I think you all had a field day with it at the time, so if you really want to, you can go back and see that fantastic footage.
When you say you have no recollection of communicating privately with
Well, you're talking 5 or 6 years ago. As I say, the instances where I erred and did use my Gmail, they have now been well publicised. There was plenty of reporting on it at the time. It made me look a bit silly. I'm sure I'm not the first person to have sent themselves an email with test in the subject line, but maybe I'm the first person to have it released under an RTI.
Is another former government employee who is chipping in with calls for an inquiry into the integrity of government on a wider scale? How many more is it going to take before your government, the Premier's government, has decides a bit of room to at least clear the air for you?
Look, as I've said, we have such an inquiry. That's what the CCC is. That's the CCC's job. And if anyone has anything new that they would like the CCC to investigate, I would urge them to refer it to them. Look, I understand that there have been some questions raised about the CCC, and we have adopted the recommendations of the PCCC's inquiry. But once those recommendations are implemented, the CCC remains the appropriate forum, the standing forum for all of these matters. And if anyone, as I say, has any new evidence, they should forward it to the CCC.
As Joel says, it's been a pretty steady stream of insiders coming forward. Should Queenslanders be confident with the government's process?
Well, I think Queenslanders are confident with the government's processes. When I talk to folk, this is not what they raise with me. They raise with me their concerns about what's happening in aged care, their ability to get a rapid antigen test. A lot of people came and saw me yesterday to tell me that their chemist had them in now, which is really good news. They're the things that folk out in my electorate are talking to me about.
Do you think Queenslanders don't care about the integrity or questions about the integrity?
Well, I think they do, but I think they have confidence in our systems and in our institutions, including the CCC, and they know that there is a standing Royal Commission with all of the powers of a Royal Commission in place every single day that can investigate these matters. Indeed, many of them have been investigated, and there has either been findings or otherwise, or they are still under investigation, and for that reason we aren't able to comment in a fulsome way on them.
As the saying goes, if there's nothing to hide, there's nothing to fear. So why not announce an inquiry into the integrity of the government just to clear the air once and for all? Clearly, more and more employees are coming. And so if we were to announce an inquiry, it puts them to the limelight.
Well, because we have an inquiry. That's the CCC's job. The CCC is there every single day, and if anyone has anything new, they should refer it to the CCC.
The Cabinet did vote, though, to overhaul the CCC. Like, it is sort of like it's without its head at the moment.
Well, it has an acting chair at the moment. We we agreed to implement the recommendations of the PCCC. The CCC is an incredibly important institution, and we need the public to have confidence in them. If that requires reforms, then that's what we've undertaken to do with the help of the architect of our integrity system, Tony Fitzgerald. And so that work is underway. In the meantime, any other matters, any other new facts, any other new evidence should be provided to the CCC. That is the appropriate forum.
With all these arguments against very much
Look, I don't have much more to say than what I've already said. If anyone has anything new that they think should be investigated, then they should refer it to the CCC. But it's, the calls this week have been, it's a bit like the Leader of the Opposition wants an inquiry into the vibe, an inquiry into the gist. I mean, at one stage he said he had a thread. If there is new evidence, then it should be forwarded to the CCC. But you can't have a Royal Commission into the vibe. I think most of what was there today he said publicly before. Thank you.
Yeah, I don't blame him.